Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, and I want to say thank you for tuning in to this month's broadcast. We have some vital information, as always, that will help you to take control of your health, giving you the information, the tools, and the resources you need to live a healthier tomorrow starting today. This show wouldn't happen without your support. So take a moment right now and text your friends, text your neighbors, share the word on Facebook or Twitter, or whatever. I don't know all the social medias, but wherever you share your words, share this broadcast. Let them know that A Healthier Tomorrow is on the air right now and that they should tune in. We have two amazing guests today that will be talking about lung health and the importance of quitting tobacco and smoking. I'd like to welcome our guest, none other than Dr. Hamilton from Sunrise Hospital. So grateful you could join us this morning, Dr. Hamilton. Please tell our audience all about you and your work.
I'm Tim Hamilton. I'm a cardiovascular and thoracic surgeon. I work here at Sunrise Hospital. I operate on the heart, the lungs, the other organs of the chest, the vascular system, and have a special interest in treating lung cancer.
Awesome. Well, thank you again for joining. And that's exactly what we're going to talk about today is lung cancer, which is something people don't necessarily know enough about, but it's the number one cancer killer of both men and women in our nation. So my first question for you is, what is it? What is lung cancer?
There are two broad categories of cancer that come from the lungs. One is what we refer to as small cell lung cancer, and that is a cancer that develops from what we call the neuroendocrine cells of the lung. Those aren't really involved in breathing per se. The other broad category is non-small cell lung cancer, which does come from the cells that are involved in breathing. And again, within that category, there are two subsets. One is what we refer to as squamous carcinoma, and that's a lung cancer that derives from the cells that line the air sacs. And the other is adenocarcinoma. And those are more glandular elements within the lungs. So what we're generally talking about when we discuss the surgical treatment of lung cancer is non-small cell lung cancer, either the adenocarcinoma or the squamous carcinoma.
Okay, so this may be kind of a silly question, but I got to ask because I'm curious. Why is it instead of like big cell lung cancer, like small and big?
That's a good question. Actually, there are some tumors in other parts of the body that are referred to as large cell. Excuse me, but because of the appearance histologically under the microscope of the cancers of the lung, small cell was really the first that was well understood, and it has a very particular appearance, and it kind of looks like an oat, and it's also sometimes referred to as oat cell. So once that sort of became categorized as a subtype all its own, everything else was not that, therefore non-small cell.
That makes sense.
Sure.
What are some of the risk factors for lung cancer?
Well, I think it's pretty well understood, and although a lot of people don't acknowledge it, smoking is the single biggest risk factor for the development of lung cancer, the single biggest risk factor that can be modified. Other toxic ingestions can lead to the development of lung cancer. There are some fungal agents that used to be found in like stored wheat and so forth. Some other environmental toxins, radon, which was a big concern in the 70s and 80s. A lot of us have radon test kits now when we buy a house to make sure we're not sitting on a collection of radon. These are all things that can put a person at risk for the development of lung cancer. A family history can also play a role, but again, cigarette smoking and exposure to cigarette smoke is the single biggest modifiable risk factor. So not smoking is key.
Would that include like the new vape and Juul and all of that?
Yeah, the vape and Juul are are problematic in the development of other lung pathologies. A lot of us are seeing some really strange and unusual inflammatory processes that develop in the lungs of vapors. The long-term effects of exposure to these substances is really not well known, whether we're going to see more and more aggressive lung cancer or less and less aggressive lung cancer. But some of the toxic products that are found in these vape products are causing terrible acute lung injury that can put people on ventilators and stuff.
Wow. Okay, but what about the environmental factors? Because one of the things that I care about is our planet. What environmental factors are contributing to lung cancer?
Well, there's always been some concern and an attempt has been made to try to link air pollution to the development of lung cancer. That link is not real well established. Lung damage in the forms of some of these inflammatory things like we're talking about with vape and Juul have been associated with long-term exposure to smog and so forth. Very high level exposure to diesel fumes and some other smoke from factories and stuff have also been associated with lung cancer. And of course, the coal mining industry for many, many, many years has been associated with the development of black lung disease, which is not a lung cancer, but rather it's a deposition of the coal particles in the lung, which makes the lungs no longer work as they're designed to work. So the lung damage there is every bit as lethal as a lung cancer, but it's a completely different animal altogether.
And our lungs are so critical. When you can't breathe, there's really not much else that matters. So
Yes.
what should people be looking out for? What symptoms would they notice or signs that they may be experiencing lung cancer?
Well, that's one of the biggest difficulties in managing and dealing with lung cancer is that the signs and symptoms that appear very, very late in the disease when it's virtually untreatable. Pain in the chest wall usually means that the cancer has grown out of the lung and into the lung surrounding and into the chest wall and the bones and the soft tissues and the nerves. And of course, by that time, it's very advanced.
And that would be stage 4, is that right?
It could be stage 4. It could be a very advanced, slightly lower stage tumor, the one that's not going to be easily treated and one that may not respond to our usual modalities, but it will be a very advanced cancer. And remember, even early stage lung cancers do not have the prognosis of some other cancers that we're used to talking about. Stage 1 lung cancer is treated surgically successfully does not have a 100% survival associated with it, like some other tumors have much higher associated survival rates. A stage 2 and a stage 3 lung cancer, even if successfully treated initially, may only have a 40% 5-year survival associated or less. So stage 4 isn't necessarily the end of the story. Stage 2s and 3s that require a lot of treatment that can be hard on the patient, let's say, that may actually be a situation that's worse. And some of these tumors that grow into the chest wall, we're talking about very disfiguring kinds of operations if they're possible to be performed at all. So yeah, those symptoms that do appear much later and usually portend a poor outcome. Some of the other symptoms we might think of are a cough that won't go away, that's been misdiagnosed as pneumonia for months. Coughing up blood, something we refer to as hemoptysis, is usually a pretty late finding. Sustained weight loss can be associated with any cancer, but it's particularly common in lung cancers. And another problem with lung cancer that we see is that it coexists in patients who already have pre-existing lung disease, emphysema, or other forms of COPD. And so the patients have got some symptoms related to their intrinsic lung disease, cough and difficulty breathing and so forth, all of which may be masking a cancer that's been hiding for some time.
Wow. So what is the screening process like? Who's eligible for it? And what should they say to even get the screening?
Well, the screening process that's been developed for lung cancer is what's called low-dose CT scanning. It's a little bit like mammography, mammograms to look for breast cancer, in that it's an X-ray study that looks for an abnormality in the pictures. Low-dose CT scanning does not involve administration of any of the IV contrast that people may be concerned about due to allergies or kidney function and so forth. It's a quick scan. You lay down on the table. The scanner runs over your chest and takes pictures, and then the radiologist can review and see if there's any abnormalities. As far as who's eligible, the guidelines at the moment are for anybody age 55 to 77 who has a 30-pack year smoking history, who quit within the last 15 years, or that same age group who is an active smoker. People who have had, let's say, a chest x-ray for some other reason and see an abnormality on it are no longer considered to be patients for screening. Those are abnormalities on these other films that need to be followed up with dedicated scanning to look and further describe what that abnormality might be.
So the key piece there is the smoking pack year history. How does that work? What is a pack year?
Good question. I kind of glossed over that. A pack year equates to a pack of cigarettes per day for a year. So if I'm 25 and I start smoking today and I smoke a pack a day for 10 years, that's a 10 pack year history. So somebody age 55 who started smoking a pack a day when they were in their mid 20s would have a roughly 30 pack year history. And it's that continuous exposure to the cigarette smoke that causes repeated injury and damage to these cells, and then leads to genetic mutations and DNA changes and so forth that'll result in the development of a cancer. And this regular exposure to cigarette smoking, when one does the smoking themselves, is one thing, but people who are exposed to secondhand smoke on a daily basis are also at increased risk. But it's extremely difficult to quantify, because how much cigarette smoke was I exposed to dealing cards, let's say. So those folks are a special concern in our community. They're at increased risk for lung cancer, but it's very difficult to quantify.
Can an individual request the low-dose CT scan on their own, just saying, hey, I've been in the casino for 30 years, I want to get this scan? Or how does that process work?
There's a couple of ways that can be pursued. One is to speak to your family doctor and say, as you pointed out, I'm in this high risk group and I'd like to be screened, and that can usually be arranged rather quickly. In the absence of a family doctor or a patient who just has concerns for themselves or a loved one, they can call the lung information line at Sunrise, and we'll surely be passing that number. I think it's 961-9324, if I'm not mistaken, but we'll be sure and have that number here in just a second. But a patient who has those concerns can call the lung information line and be referred and get the screening done relatively quickly.
And yeah, we'll make sure to put that number in on the screen for those that are viewing. What is the importance of early detection in this case? Because you've mentioned even early stage can be quite difficult to treat. So just help us understand why early detection is still important.
Well, the earlier any problem is identified, the better the chances are of a successful outcome, whether that's a leak in your transmission or a drip from your sink or a breast cancer or lung cancer. Earlier stage means the tumor's had less time to spend in the body, sending out its cells to go to other places and take up residence as a metastasis, for example, or less time to invade locally into structures and areas that can't be removed or have to be sacrificed or whatever. So the highest likelihood of a successful prolonged outcome is the earliest stage. and those percentages decrease over the time and over the stage by stage, as you'd expect. So yes, earlier the better. You pointed out that our audience has a high incidence of cigarette smoking, and cigarette smoking has been stigmatized, right? You can't smoke in your office anymore. You can't smoke at the restaurant anymore. You can't smoke in the casino. All of these things are good changes in a societal sense, because the danger and the damage that can be caused by cigarette smoke is pretty well established. And unfortunately, though, folks who are still smoking, because of the stigma, are hiding in the shadows in some cases. And I talk to folks every day in my practice who've been long-term cigarette smokers, and cardiac disease and vascular disease and lung disease are all associated with cigarette smoking. And so we see a lot of these folks, many of whom didn't start smoking because they wanted to do bad things to themselves. None of them did. Many of them were given a pack of smokes in their ration pack when they were in the service, or they grew up in a time in this country when cigarette smoking was chic and cool and helped you keep weight off. And it's an addictive drug. It's as addictive, if not more addictive than the opiates that are currently the focus of everyone's attention. And so because of the stigma, because of hiding in the shadows, and because of the guilt associated with being a cigarette smoker, folks are not seeking help. And that's terrible, because again, this is a treatable problem. It's difficult to quit smoking, but it's more difficult to treat a stage 4 lung cancer. It's much easier to address it early on. And so folks who recognize and identify themselves as somebody who's at risk, 55 to 77 with a 30-pack year smoking history, should reach out, call the lung information lines, speak to their primary care doctors, and get identified. It's not your fault that you're a smoker. It's not your fault that you develop lung cancer. It's our job to educate, and it's our job to treat and protect folks. And so the sooner we meet you, the sooner we can do something positive for you.
Thank you so much for highlighting that. I think that's absolutely essential for people to hear. There's no judgment, no stigma in this. This is about your health. So awesome. Well, I think we can leave it there. We'll have to have you back again. Again, a wealth of information. So thank you so much for joining us this morning on A Healthier Tomorrow.
My pleasure, Will. Thanks so much.
The A Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. On behalf of our office, we want to wish you a happy and healthy holiday season. May all that is beautiful, meaningful, and joyful be yours this holiday season and throughout the coming year. And with that, I'd like to welcome to the show a good friend and coworker, Malcolm Ahlo. Good morning, Malcolm.
Good morning, Will. Thanks for having me.
Thank you for closing out our year and for talking about such an important topic. For those that haven't heard you on the broadcast before, if you could just let us know what it is you're doing and why you're here today.
Of course. Again, thank you for having me. I'm excited to be on the show. Proud supporter and viewer of this program. So my name is Malcolm Ahlo with the Southern Nevada Health District's Tobacco Control and Prevention Program. What we do at the Health District for Tobacco Control and Prevention is a multitude of things, from policy, but more importantly, what we're trying to do is give people the resources to help them quit smoking through smoking cessation programs across our valley. So that's what I'm here today to do, is to promote our cessation resources that we have here and encourage our community to quit smoking.
Yeah, and you know that's, of course, a big part of my heart, of course, with the work with the Lung Association. And I just believe that quitting smoking is perhaps the single most important thing someone can do to improve their health. And the resources that you've provided in partnership with us at the Lung Association have been amazing. And we've helped thousands of Nevadans quit over the past few years. So I just want to start this by saying thank you for your support and your insight and genius in this area, because you really have a knack for helping people. Would you share a little bit about some of those resources that are available?
Yeah, absolutely. And just to give you the gratitude right back. So we could not have done any of our programming or our cessation resources without you, Will, and the American Lung Association. So thank you for that. There is no better time than now to quit smoking. We're in the middle of a global pandemic. Hopefully we could have said we're at the tail end, but now we see new variants coming up. So we will say we're in the middle of the global pandemic. So now more than ever, we're encouraging anyone who is current users of tobacco products to quit. But we understand that quitting is hard, but there are resources available for everyone and anyone from any type of community or any type of population. There's help for you. So the most important thing, or the easiest way that we like to promote cessation, is by having anyone call 1-800-QUIT-NOW. That's 1-800-QUIT-NOW, and that equals to 1-800-784-8669 from any telephone number, and you get patched to the Nevada Tobacco Quit line. And the Nevada Tobacco Quit line is staffed with certified cessation counselors that will help guide you every step of the way, from picking your quit date to how to address your triggers and celebrating your success when you're finally smoke-free. In addition, the Nevada Tobacco Quit line can also provide FDA nicotine replacement therapies such as lozenges, patches, gum, for those who call and that are qualified. In addition to the 1-800-QUIT-NOW number, there are also in-person classes like Freedom from Smoking, like from the American Lung Association, and a few hospitals around town also do in-person cessation classes. So whether you like to do it on the phone, on the web, or in person, there's help for you.
What about youth that are looking to quit, maybe with vaping or combustible cigarettes?
Absolutely, and you brought up a good point. So as we all know, the vaping epidemic has taken over our youth. They say reports of up to 7 in 10 youth have tried vaping products, and over 30% are current users of vaping products. So, it's a big problem that we had. And when you compare that to combustible cigarettes or our old-fashioned cigarettes, our youth rate of that is 4 times less than vaping. So you are correct. Our youth are vaping, and we need to get them to quit. And we encourage anyone to refer youth to mylifemyquit.org. Mylifemyquit.org is also a part of the Nevada Tobacco Quit line with the same services, but tailored specifically for youth. So it's youth counselors talking to youth in their own language and giving them their own support.
It's so important for parents to hear that, because a lot of times they don't feel like they even know where to start with the conversations. And just to know that there's an opportunity that's tailored for their youth, I think makes a big difference and will really help our community.
Exactly. And we know that, the fastest way to get a teen to do something is tell them not to do it. So sometimes when parents are saying, quit smoking or stop vaping, that might not be the right approach. So we just like to tell parents to, one, be armed with how to talk to youth about quitting or the vaping issue. And if they're not that comfortable, they can go on to mylifemyquit.org, and there are resources on that website for parents to give them tips on how to talk to their teens.
Now, Malcolm, we have some listeners that tune in every month, and I want to say thank you to the listeners that are so supportive and faithful. So they hear me talk about smoking cessation a lot, but you've been doing this far longer than I have, and you've been in our community longer. So what have you seen change with this issue over the years, and what can you say that may give us some inspiration for those of us that may not use tobacco and want to help others, but feel like it's just really, really hard?
I think as a community, I've been doing tobacco control for 20 years now, Will. You're aging me a little bit here, but when I first started, the community might have been so supportive when it comes to policies and social acceptance of smoking. We've come far. We have a reputation here in Las Vegas that we're Sin City, but that's actually not very true when it comes to the tobacco prevalence rates. When we compare how much we smoke here in Nevada compared to other cities, especially in Las Vegas, we're actually lower than the national average. So when you're talking about how has our community changed, I think perception of the acceptance of smoking has shifted. We no longer just accept that people can smoke indoors, which we know that is not legal. And another thing that is the investment from our public health advocates in our community. You know, they value cessation. They want people to quit smoking, and chronic disease prevention, which is a result from not smoking, is a priority now, I believe, in this day and age, especially in our global pandemic.
Yeah. And as you started, now more than ever, it's so critical that people do quit. But I thought it was important to share how things have changed and give people a better perspective on what's really happening right here in Las Vegas.
Yeah, exactly. And, you know, when I started, I said, you know, quitting is hard, and we understand that, you know, nicotine is a very addictive drug. But the alternative is quitting. Not quitting is harder, right, Will? So it's like, you know, quitting is hard, and fighting those cravings and dealing with those, you know, weight gain and moodiness, et cetera, that is all difficult. And those are real experiences. But the alternative is not quitting, and potentially having lifelong chronic diseases, such as cancers, as we all know, heart disease, diabetes, et cetera. Smoking causes all of these things. So there is no better time than now to quit smoking.
As we're heading into the holidays and the start of a new year, do you have any tips or ideas for people that are making that decision as they're hearing you talking today?
Yeah, absolutely. You know, we all know it's resolution time. So the number one most important resolution we can make, I believe, as a person for ourselves, if you're a tobacco user, is to quit smoking. You know, select a quit date. Select a quit date now. Tell those who are around you that you're going to quit smoking, and select that date. We try not to encourage people to make that date on December 31st or the 1st. You know, that's when usually people are celebrating, etc. But make it on the 2nd or the 3rd once you get over the celebration, because we want you to succeed. So select a quit date, I think, is the first step. Tell your friends and family and those that are around you that you're going to quit smoking, and you'll be surprised how much people support you and support the move to help people quit smoking.
We should have had this conversation earlier, because I started my diet already. I didn't know I could wait until January 2nd.
Well, at least you started. I just keep pushing my diet date back all the time. So.
Oh my goodness. Well, Malcolm, thank you so much for joining us this morning in your busy schedule. Again, you are a true asset to our community. Thank you for your longevity and your work with us. And could you give us that number for people to call one more time before we go?
Absolutely. Again, the resources are 100% free. All you have to do is call 1-800-QUIT-NOW. That's 1-800-784-8669. Or you can visit it online at NevadaTobaccoQuitline.com. And for teens or youth under the age of 18, that website is mylifemyquit.org. And again, we encourage everyone to quit smoking as we head into 2022. It really is one of the best things you can do for yourself and your health.
Perfect. We'll leave it there.
Thank you, Will.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. This flu season, help keep yourself, your family, and our community healthy by getting a flu vaccine. It's the best protection against the flu. Free or low-cost flu vaccines are offered at community locations across the valley. For more information, call the Southern Nevada Health District at 702-759-0850 or visit snhd.info/flu. All right, well, that is our show for this month. I'm going to say it in advance. Happy New Year, Merry Christmas, Happy Hanukkah, Happy Kwanzaa, all of the holidays. Just happy holidays to you and yours. This year has been tough, but here we are together, and the future is still bright. There is still, the best is still yet to come, and we will get through this together. Thank you so much for joining the program. This is A Healthier Tomorrow. I'm your host, Will Rucker. And as I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately, and I'll see you next year.